our Veteran Services Program. Our Veteran Services Program is mainly for those who need residential care for mental health or for substance use disorder. So I work to navigate their care across the nation. And I will moderate the panel today. If you have any questions that you would like to share with our panelists, or if that you would want them to be anonymous, you can input them into the chat. If you hit the to button, you can send them to me directly or to the panelists directly, I believe. And we'll be able to integrate those in when questions come up if you're not comfortable with your name being attached. You're also welcome to add any questions that you don't want to be anonymous into the chat, and I will bring them to our panelists as they fit. And then if we have things that don't fit right now, we can always send them individually to the panelists to get addressed later, and we'll be able to pull your information from the registration. So first, I'll let Hillary introduce herself, and then we'll have Kate introduce herself and Conrad when he's able and pops on, and then I'll introduce the purpose of the panel.
Hi, everyone. Thank you for joining us. I'm Hillary Lum. I'm a geriatrician and palliative medicine physician at Rocky Mountain Regional VA Medical Center and also University of Colorado Hospital. I have been part of Colorado Veteran Community Partnership, which we abbreviate VCP, since we kicked it off back in 2017. So thank you so much for joining us today. It's great to see so many friendly faces.
Thank you.
You ready for me? Okay. I'm Kate Hatten. I'm the Executive Director of Homefront Military Network, and you'll hear more about what we do later, but I'm just a spouse of an Air Force veteran and have been here on and off since 1992, and Colorado felt like home, so that's where we stayed. Oh, I'm part of the panel group.
Awesome. Well, looks like we're still waiting on Conrad. I can give a little bit, if I can see it, let me see if I have it, of who he is. Hillary, if you have your, I'm sorry, Courtney, if you have your email pulled up, could you send me back the bio from him, and I'd be happy to read it while we're looking for that. Thank you. Just trying to find it.
I'm also happy to read it. So we're really grateful that Conrad Sperling is able to join us, hopefully soon. We practiced and also anticipated technology issues because they come up, and I'm glad we have this chance to chat about it. Conrad Sperling is a Vietnam veteran, has been playing guitar since he was 12 years old, and has entertained his fellow service members. He currently plays for residents in long-term care facilities on invitation, and it's really terrific to hear his experiences doing that. Conrad enjoys spending time with his fellow veterans and sharing his love for music. During COVID, he had to change the delivery system like the rest of us, and so I'm excited for us to hear how he has been navigating technology to reach individuals who are in VA state veterans homes and other nursing residences.
Thank you, Hillary. So as you all know, we're kind of here today to talk about telehealth and how everything has changed over the past year after COVID, when we started to have to use virtual means to communicate with each other, our family, our friends, our physicians, anybody that we really needed to get in contact with, even ordering our groceries for some point of time and for some of us. So we wanted to talk about how we've seen a huge change in the way that we're receiving all of our communication, including our healthcare, and how we're connecting with one another. So before we had the pandemic, we always had these options. Well, not always, but we've for a long time had some telehealth options, but they were not as widely used. So they were a little bit different. Sometimes for the VA, I know the clinics, you would go into the clinic and you may access a physician or somebody who is off site, but you'd still be going into that individual clinic. Versus having that healthcare delivery right in your home. So it's been a big change for all of us. And for the first time, we learned to use things like WebEx or Zoom, and learn to navigate all the technology that comes along with it and the differences between platforms. So I know for many of us, that was not a daily piece of life. And now we are all embracing it, and we've all kind of figured out FaceTime for the most part, being able to set up family Zooms, and being able to use that for our healthcare and other platforms as we continue to communicate the things that we need to have done. So today we'll discuss what that looks like for each of our panelists and some of the changes that they've made to delivering care or entertainment from Conrad. Awesome, and it looks like Conrad has jumped on. So if he'd like to say hello, Dr. Lum has introduced you briefly from the little bio that we have, but if you have anything to add, we'd love to see your face and say hello.
I think you might be muted, Conrad. I think, Conrad, that you might have some microphone issues, but we'll just give you a second. I just wanted to also let everyone on this call know that we are recording this panel discussion, and we will be adding it or uploading it to our VCP website. And I will put the address to our website in the chat box.
Can you folks hear me now? Okay, great.
I'm here.
Oh, I'm sorry. How about now? Can you hear me? Okay, my apologies. Okay. I just wanted to add that when I was doing video connect with the veterans at these long care facilities, that I found it to be really helpful for them just to use their default platforms on their videos on their computers, because if they tried to up it or put stereo, it really messed everything up. So that's my input.
Yeah, we definitely have had quite a few things that we've had to overcome, like adding the audio in and getting that together. Did you want to add anything else about yourself? You introduced your role in the community and you as a veteran.
Yes, I am a veteran, Vietnam veteran, and of course, I went to Vietnam. And during the time that I was in the military, because I was able to perform with the guitar and perform, I entertained a lot of soldiers, so, and I still do.
We're very lucky to have you.
Thank you.
All right, so the way that we thought we would set this up is to have everybody kind of do a round robin, and we'll go in the same order that we introduced ourselves. So first Dr. Lum, and then Kate, and then Conrad. So the first piece is asking each of you to share how the pandemic impacted you, what changed for you, or how you were delivering services, or what changed for the veterans that you serve. And Conrad, you're welcome to speak from the veteran perspective if that's accessing care or delivering those presentations, okay?
Okay.
Or songs or performances. That's the word I was looking for.
Okay. Well, let me see. What changed for me as far as the pandemic? Well, first of all, my in-person with the veterans at these long-term care facilities and the VA hospitals was non-existent. So we had to use Zoom to make a connection with these veterans at the hospitals, and of course, I had to make a lot of adjustments. I couldn't use a sound system because of the platforms they were using. Sound system would just really cause a lot of background noise. So it was just my one of my Martins and myself, and adjusting the computer so I could they could hear it, the music, and when I was performing. So it worked out pretty well, and so. That's what I did. That's how it changed my life as far as the pandemic.
Well, I'm glad you were able to navigate that and continue to do the thing that you love. Dr. Lum, would you like to speak to how things changed for the veterans you were serving and how you've adapted at the VA to continue to deliver services?
Like many of the other healthcare facilities, in March 2020, our VA services to coordinate geriatrics care for rural veterans needed to completely pause for some amount of time. The clinics closed in the community-based outpatient settings, and we rapidly worked to figure out how we could provide more information about how to use devices, sending internet-equipped devices out, and then trying to provide appropriate technical support. So as we transition into resources in a little bit, I have a few slides to share some of our lessons learned in the resources that we have. I'm grateful for the commitment the VA has to being able to provide telehealth for medical care. And I'm really glad we're having this discussion today because I've learned from several of you on this call, and it's worth mentioning that even though VA, from my perspective, was able to somewhat rapidly work to have medical care continue, there were still significant gaps related to VA benefits and other important offices like Comp and Pen. So, sort of my section of the VA, we were able to adapt, and I recognize that there's still a lot that continues to not be back up to speed and fully online.
Yeah, it's definitely a multifaceted process, especially when delivering such a big section of healthcare and such a diverse section of healthcare. What about you, Kate?
I'm back. So do you want me to share slides later? And that's where I'm confused a little bit. Sorry, just kind of give a quick overview.
Yeah, I think first where
Okay.
we think they fit better. So we're going to go through what changed, and your slides might fit that better, depending on how you want to. And then we'll talk about resources that we can recommend, and then the vision for moving forward. So
I'll just do a quick overview of what we got and then do the slides later. Sorry for the confusion on that.
That's okay.
So the short answer is the good news for us is that Homefront Military Network provides information assistance and financial assistance statewide. So we've very much always been heavily web-based and call-ins. So it was really relatively seamless to veterans and others who needed assistance. Our team was able to work remotely with really no adjustments to our processes and the information out there. The challenge more for us was people knowing who we were because we had just merged two organizations. So that made it more complicated in terms of messaging. But for people to be able to reach us, it was pretty seamless to call a phone number, reach us through our Network of Care website, where there was an online form so that we could connect to people by email, text, call, whatever worked best. So there were certain things that were advantageous to us at the beginning, and it enabled access statewide. So we already had those kind of technology platforms in place. The challenges for those who had limited technology capabilities, and we could talk more about that later, but those are sort of the things that we saw moving forward.
It sounds like everybody had to adapt quickly in this small group, and we know that everyone in the community and across the nation really had to adapt to the changes. So it's good that you had that platform where you could just shift it to everybody's homes, but it does definitely make some challenges for the folks that maybe weren't as tech savvy or didn't have access to internet and things like that.
Absolutely. That's where you have to get creative.
Yeah, that's part of our job, right? Always navigating care quickly. So let's talk a little bit about resources that we've identified and or created in response to the need for telehealth services being more broad and widely used. And we can start with Dr. Lum on that. I know she's got a couple slides she's going to pop up.
Okay, so hopefully the technology is working. Katie, can you see the slides and hear me?
Yes, and yes.
Perfect. So, and these are going to be posted on our Veteran Community Partnership website. So the hyperlinks will be available to anyone who wants them. I really wanted to highlight some of the resources the VA has made hopefully more robust and more functional. We know at baseline that 15% of veteran households do not have an internet connection based on a 2019 report. Hopefully that has increased and maybe is a silver lining of the COVID-19 pandemic. Regardless, at the VA, we really are committed to wanting to bridge what we consider the digital divide, where individuals have various barriers to being able to use technology. We are committed and have policies in place since I think 2018, where the VA said, let's make sure that we can, from the VA, wherever we are, from anywhere to anywhere, reach veterans to increase access to care. So I'm going to overview a handful of VA telehealth programs. As examples, from the Rocky Mountain Regional VA Medical Center, we are able to facilitate care to other VA medical centers like Cheyenne, or to VA community-based outreach clinics, and I'll show you a map later. And then I'm going to really focus on our efforts to reach veterans at home via tablet and our type of clinic visit that we call VA Video Connect. So I recognize, and one of the reasons we wanted to do this panel is that there may be some names and jargon and labels that we use at the VA, and maybe if you are serving veterans as a community organization, being able to have awareness of these programs and perhaps know some of these key words can help you as you are advocating and navigating and supporting veterans through your organization. Using VA Video Connect hopefully is something that veterans are able to navigate. There are two videos online that I'm not going to have us watch now, but I really want to point out this website. If you Google VA Video Connect, there are step-by-step instructions of how a veteran can use this virtual visit when they have a scheduled appointment, where their VA provider logs into the website for VA Video Connect through a link, and then the veteran also clicks on that same link. We hope that the help desk is readily accessible. This is the number that I recommend you have available. Know that veterans can call this number and that there is support for helping to troubleshoot and teach and coach the use of the devices to connect with the VA through one of these care visits. Oops.
Stephanie dropped that in the chat. Thank you for putting that in there so people can copy it over if they'd like.
I've mentioned the Digital Divide Consult. So this is a VA process. So for veterans who are already enrolled at the VA, have a VA primary care provider, or are seeing the VA for specialty care, they can navigate the VA, call in, request a Digital Divide Consult. That then triggers a VA social worker to outreach them by phone and assess eligibility for a VA internet connected device and for other programs like the Lifeline program and the emergency broadband benefit. And Here also is another website for bridging the digital divide. This is publicly available information that the VA would love for as many people as possible to know about, so that veterans can access things that they're eligible for if they're interested. So I want to tell us a little bit more about VA programs for internet connected devices. We really want veterans to know that the VA can assess for eligibility and lend out internet connected tablets so that they can participate and have access to VA care. And this could be for primary care, specialty care, mental health, can also be for additional services like physical therapy, occupational therapy, and home assessments, dietitian visits. So on the VA side, we're really working on having our teams be able to learn how to use these VA visits. And we also want to make sure that veterans have devices if they don't previously have them. Another way that the digital divide consult can assess for veteran need is if veterans have housing insecurity and are part of our what we call the HUD-VASH program, so the Department of Housing and Urban Development VA Supportive Housing Program. If veterans are in this program and they do not have a smartphone, then the veterans can receive a smartphone for participating in their telehealth care. Also, the Digital Divide Consult will assess whether veterans may already have a data plan through one of these companies and can facilitate and advocate for veteran subscribers to avoid the data charges specific to VA Video Connect visits. And here also are more websites that are publicly available, not behind the VA firewall, for learning about these programs more. So a few things that are readily available to everyone, not just veterans, that I wanted to highlight are the Federal Communications Commission's Lifeline program and the Emergency Broadband Benefit. So I think this is helpful for all of us as we understand the needs of clients and recognize how internet services can be expensive. These are programs, some of which may finish whenever the public health emergency is determined to be over. But right now, these are still available. And as part of the Digital Divide Consult, our social workers will assess and recommend and connect for these additional non-VA programs that may provide financial support. I want to just give some tangible examples of how we have used telehealth to reach older rural veterans. I'm a geriatrician, as I mentioned in the chat, and so we will receive referrals from rural VA primary care teams that desire assistance with complex geriatric care needs like dementia. We know that older adults and veterans and caregivers have experienced significant loneliness and to some degree maybe have had increased isolation, and sometimes that may be distressing. And so we have been able to see many of those individuals using telehealth, and we can assess them in our clinic specific to memory issues, or provide dementia education and caregiver support, or palliative care. So telehealth for us at the VA, even before the pandemic, and I'm glad that we'll continue this after the pandemic, is committed to increasing access to specialty care for individuals who may have hours and several miles and mountain passes to come to receive VA care. So telehealth really helps us overcome those travel barriers. Here's a map. It's a little fuzzy, I apologize, but gives you a sense of, in Colorado, there are 400,000 veterans. We know that some choose care within the VA, others choose in the community. Here are a list of the community-based outreach clinics that we have been able to coordinate telehealth visits for older rural veterans, and it is an increasing list. I mention this because as you may be serving individuals who live across the state and may have limited access to whatever services in the community, we'd love to hear about them and assist if they're interested in VA services, regardless of where they live. So I have a few extra slides here that I won't go through, but we're happy to answer any questions related to VA telehealth services. So I'll pass it back over to Katie.
Thank you so much, Dr. Lum. That was an incredible overview of the programs. I know that I had heard about the Digital Divide platform prior to COVID, and then after COVID, I've seen a lot more surrounding it. I think it's a great asset for us to have and be able to connect those who maybe not had internet before or may not be comfortable navigating the VA through that platform. So having that additional support will help them out a lot. I know even my parents who are in their 70s now, they're like afraid they're going to break it. And so unless they have somebody else that's there to help them along the way or navigate those systems, then they get a little skittish when it comes to using something that's new and different. So it'll be great. I think, Kate, this will be a good time for you to show those slides if you'd like and share the resources that you offer at Homefront Military Network. I pause every time because they used to be Peak Military Care Network, so I'll get it right.
Explain that too. I'm working on pulling up my slides. Give me a second. All right. Just a couple here to kind of go through. So yeah, Homefront Military Network, that to Katie's point, and the one thing I wanted to remind folks is that Homefront Military Network was created by the merger between the Homefront Cares and Peak Military Care Network. And that happened right in the beginning of 2020, and then the world turned upside down. So trying to message that, so if folks who are familiar with the Homefront Cares or Peak Military Care Network, we're now operating both missions under one new umbrella, and that is Homefront Military Network. Really, we connect the dots. So not only providing financial assistance, but also being able to look at the holistic needs of service members, veterans, and families, and to make sure the whole family is taken care of. And how we do that is, again, very much web-based and call-in. So our Network of Care website has resources, a resource directory, as a lot of other information. I was asked a question earlier today. There's a place where when people don't have their DD-214, you can store your DD-214s and other information electronically through this website that you own. It's password protected, it's secure, so that if you don't have something with you, if you can access the internet, you can have it at all times. We also have an online forum. If you can't find what you're looking for, or you don't know where to start, there's an online forum on this website where you can just put in your name, contact information, and a brief information about what you're looking for. Our case management team can then contact a veteran and find out what the needs are and get more details and be able to connect to the right services, as well as by phone. Our phone numbers our phones answered 8 to 5 p.m. Our team's really busy, so you might have to leave a message, but the good news is you can leave a message. I know at the height of the pandemic, there were a lot of agencies whose mailboxes were full or weren't, and so people had trouble leaving messages. And so just trying to get a hold of somebody was a challenge, but we do have the capabilities, particularly, and if, like I said, through multiple ways to get a hold of us through our email, again, that online form, or by calling us. And really what we saw is just a huge need, just to kind of get into some of the details on that. We had a 300% increase in calls in 2020. Again, going back to folks challenged by a lot of issues, 60% said they were affected by the pandemic. They were either ill and lost time at work, or lost their job, or had to quit a job to take care of family members and things like that. And again, people came in the door because they needed financial assistance, but really people had complex needs, and really trying to help them navigate multiple resources. And that's what we're able to do. And we do that through a partner agency network. And so talking about kind of that digital divide and how we collaborate, because the goal is really about collaboration. Not one agency can do this alone. So we want to partner with the VA and other providers to make sure that we can make folks whole. Some examples of that is, for example, of our case managers and challenges and blessings during the pandemic, being able to provide resources through online forums, or again through call-in or email, those sorts of things, was able to continue to connect to people. For those who don't have access to those services, and what a great list of services and resources available that Hillary showed around how to get connected if you're not connected. But some people are just not computer savvy, or again, and so how do we help those folks? And so sometimes we had to do kind of a three-way call, and so that we could get permission to share information, or could have that person directly talk to a utility company, for example. Or, you know, in the past where we might have relied on a county veteran service officer in a rural community to help a veteran fill out a financial assistance application, how could we do that and kind of adjust when those offices were closed? And so, but there are resources. We're going to continue to do what we do and provide some of this assistance. I think that was really all I had in terms of slides. But really trying to, again, make those connections. Another example is the El Paso County Veteran Service Office now has a hearing room. They've set up a hearing room. So if someone does not have access to the internet, or they don't want to sit in their car and use a smartphone or Starbucks, because you don't want to have private conversations and that, so that they're doing, if you want to, you can use that resource. You can call the county VSO to be able to use their room to do a hearing completely in private, and that's secure, that's closed, and not in a coffee shop if you don't have access to something else. So that's how our partners are working together to kind of find resources. So really it's just about how do we get creative. We'll continue to use technology because it's helped us reach more folks with some more access to being in person and doing things. You know, that was the biggest challenge, is how do we get the word out to people, particularly who might want that, even if they have capabilities, that sense of occasion of getting out of the house, putting on pants, and actually connecting with folks. Certainly it's helped, the technology has helped with some of that isolation, but being able to kind of connect in person, we know folks want to be able to do that too. So trying to be able to figure out a hybrid way to keep doing that moving forward is what we're hopefully able to continue. So I wanted to see if I can get out of this. I'm happy to answer any questions. I'm gonna stop sharing my screen, but hopefully that made sense.
Perfect. So before we kind of talk a little bit more about what we're thinking in the future, I wanted to see if anyone had any questions for Dr. Lum or Conrad or Kate. Again, just a reminder, if you don't want to have your information out in that chat, you can private message me on the chat feature and I can put some questions out there. Trying to see. We had a reminder that, oh no, we covered that one with Courtney. So nothing in the chat right now, but I did have one.
I see your hand. If, please unmute.
Okay, this is something that I've experienced because I live in Georgetown and the closest CBOC is in Golden. The upstairs is the mental health clinic, and I'm able to do the video connecting with my provider that does my meds. But downstairs where my practitioner is, she's not able to do it. And so I'm thinking, what's up with that? Why can they do it upstairs, but they can't do it downstairs? You would think that they could do it in the same building.
Yes,
That's my question.
Yeah, thank you for making that observation, and because we know that that issue is very frequent. All VA providers are being asked to learn how to use VA Video Connect, and we are able to receive the technology, webcam, headset, you know, for audio and visual. So there can then still be multiple barriers on our VA clinic side that we need to continue to work to improve. What I will say is I've realized that telehealth is a team-based sport. And so I'm very appreciative of how in the VA, we have a position called a telehealth technician. We also have many people involved in sort of the telehealth department. What's tricky is that we're also learning ends up being a little bit of a silo because of COVID, where now we want everyone to do telehealth. It's no longer sort of where before we just had a handful of people doing telehealth. Now where we want everyone to do it, we as the VA need to continue to be as flexible and you know, moving toward change as possible, where we have more integrated knowledge for telehealth across all of our teams. And that's both a knowledge, but then also a staffing piece. We're working on it.
Thank you, Dr. Lum. Conrad, I'd love to hear from you and kind of what did you experience, especially once you got that first video to come up, and you were able to do a performance. How did people look and how do they look now? Did you have a lot of challenges with them accessing it, or did you find that there were people willing to help you to get your voice out and everybody up on the screen so you could see them?
Well, it was a, excuse me, it was really, it was very interesting. I'll say that. I'm not very concrete, but it took a little time to work out the details on the other end and my end when I first started the video conference for these long-term care facilities. But eventually, after about 10, maybe 15 minutes, everything came together. And I was able to do the performance for the veterans. And I found out that on the other end, it's hard for them to get all in the one screen so they can see me. But other than that, it worked out really well. Um, so, and also the sound quality, because I'm not able to use a sound system with the Video Connect. It's not really up to speed, but it's good enough for so people can make a connection, and you can truly see their faces. They're smiling. Just a wonderful experience. Just an absolutely wonderful experience.
So I'm so glad that you were able to pursue and persevere through the video obstacles that came in front of all of us in last March. But I'm excited for you to be able to continue to do it that way and then go back to that in person where that connection is a lot stronger. Hopefully that'll be soon.
Now, I don't wear glasses when I'm performing.
You don't?
No, I put these glasses on so I can look intelligent. Let me show you what kind of glasses I wear. Hold on just a minute. There we go.
Oh, I love them. I'd love to see your jacket in full when we can. There we go. I love it. All right. So let's talk a little bit about where we see ourselves heading. Like, what do we think is going to stick around? Kate, you mentioned that the hybrid model is probably going to be where you guys sit at your organization. And I know that there's some community partners that are also involved that are welcome to drop some of their input into the chat. I think for us, now I work in more of like a residential setting, but I know like given our we were really adapted to that virtual environment. So it'll be interesting to see as more people join that virtual piece and start to blend that in-person to hybrid visits and what you think. Dr. Lum, would you like to kick it off?
Well, I appreciate Anshal's question because I see us continuing a significant number of telehealth visits and of two types. Continuing to the community-based outreach clinic because some individuals will prefer to go to their local clinic. And then secondly, also doing the VA Video Connect to a veteran's device. So as we do more of those visits, we will need to continue to be as organized we can in ongoing training and really optimizing the communication on our side for our teams. And then also I'd like to see us expand the technical support that we have when veterans receive a device from the VA. We have a program that the Office of Connected Care out of VA in Washington rolled out called the White Glove Program. So it is supposed to be that as a device is sent out to a veteran's home, then the White Glove Program calls and provides that extra layer of support so that individuals can know how to find the email with the link and then make sure that the video visit can work and even do a test call. And we would love feedback from any of you, as you work with clients, sharing awareness of, hey, the VA white glove program exists. And then if you know veterans who are receiving devices but aren't getting that follow-up from our 800 number, we want that feedback so that we can help the educational and coaching part to work as best as it can be.
Is that tablet, like the one it's set up, is it just only to VA Video Connect, or are they able to access like community resources on it as well?
There are a couple different versions, and this is what's tricky. I, as a VA provider, don't know all of the nuances of the VA technology, and those things change as we have different parts of the VA doing different things. My understanding is that the VA device is equipped to be able to do the video visits, also has My Health eVet, and has access to the VA App Store, where there are a number of different apps specific to health engagement. I think sometimes there can also be an internet browser for some resources, but Katie, you bring up a challenge that an individual person may end up needing separate devices for separate things that they do, because one device actually isn't doing everything. Conrad, I appreciated your common sense recommendation of like, let's use what people are already used to using. And that is hard from the VA's perspective. There are good reasons in terms of HIPAA and privacy why we have specific apps, but that has, trade-offs.
Yeah, definitely. If they don't have internet at all, would be interesting. But then there's always the ability to then use it on anything that they wanted to. And the VA is now paying for just a regular tablet that they're not using even for their Video Connect. So it makes sense why they have those certain restrictions in place and to protect you. And the App Store, there's a couple of really great apps out there for those of you who might want to download them. The COVID Coach and the PTSD Coach. I know a lot of folks really like. Actually, a lot of people are seeing in our other groups that they want to continue to use COVID Coach even if COVID's not a thing. So they'll probably end up changing that to like Mindfulness Coach or something less related to the pandemic. But I'm excited to see what they come up with on that note. How about you, Kate? Where do you see yourself going forward? How do you expect to have that hybrid model? And what do you think has really, how much leverage has it given you to be able to reach beyond just the Colorado Springs area?
It's certainly being able to, we connect with folks all over the world, frankly. We've got active duty folks who are moving here to a duty station in Colorado from Italy, from, South Korea, and can connect to us that way, which is great because then you don't have to worry about time differences and everything else, and you can connect to people that way. So it increases accessibility in certain ways, for those who are able to access the internet. And so it also increases, some flexibility, again, time-wise. We're not fighting necessarily, again, time zones or things like that. And people can get information when they can, or even, after work, I'm working and I can't work, do this 9 to 5. So when can we connect? So those things make us, have continued, and we'll continue to work, through internet connections that way, and use technology platforms. We also have a monthly meeting of our partner agencies who are not based solely in Colorado Springs. And it's hard for folks in other places to particularly in wintertime, to travel far for in-person meetings. So, the feedback we get is that people would like to meet in person, and we all would. But for those who can't, we want to be able to still make sure that those folks can be engaged. And it's flexibility too. I heard that the deputy director for the Southern Colorado CBOX talking about how telehealth has, particularly the Lindstrom Clinic is very full and is over capacity. But because of telehealth, it's given them flexibility in the building to be able to offer more services and specialty care that they weren't able to because they didn't have the space. So, space is still an issue, but so those are the advantages, I think, that will make telehealth and using technology continue in the future. And so we see some, that's exciting in some ways. We all, hopefully I'm not on mute and you can hear me, because sometimes I do that.
Yes.
So, learning how to do it right is still a challenge sometimes. So we all fight the technology. Or one time, there was our internet went down when right when a meeting was supposed to start. So trying to work through those technology issues, bandwidth. I think that our providers have done a pretty good job of trying to make sure that people have access when it's possible. But so trying to find what's the right mix is what we're looking at moving forward.
Yeah. I can appreciate it from both sides of that in-person desire to meet, and then even living like 5 minutes from where you have your partner agency meeting, being like, man, I just can't leave. I don't have time to get there and get back, but I want to be part of it, and I have this space open. So I I think that you'll see a blend, and you'll see a lot of varied communication and preferences that are not always consistent, especially like going into the summer. A lot of people are on leave, and they may hop on a call even if they're on vacation just because they can, or they may be able to squeeze it in between meetings or things like that. So I'm excited to see the increased level of connectivity that we've created from this pandemic. It's part of the silver lining we've kind of talked about a few times. There's definitely been some challenges, but some great things that came forward. And I'm also glad you weren't on mute because you said some awesome things.
Okay, downside, no more snow days, folks.
Yeah, that was welcome to my pain when we started this. When I was working virtually, like for the last 5 years, and people were like, "It's a snow day," and I'm like, "Yeah, I'm still working. I can't do anything to not work." What about you, Conrad? Do you think you'll still do some video pieces that allow you to reach further and farther, or do you think that your hope is to go back into that full in-person performance?
I think it'll go back to in-person as well as video. I wanted to talk to Miss Hatten. Am I pronouncing your name correctly? I hope I am.
Yep.
About after the video session's over, some things I want to talk to you about, if that's okay with you. And so anyway.
I'll put my contact information in the chat.
Yes, ma'am.
I'd love to see some hybrid sessions from you, Conrad, where you can do a performance live with like your sound up to what you would normally do, like an in-person presentation or in-person performance. I keep tripping over that word. While you're, in your best setting, then you can also do a hybrid where you have somebody stream you either live or a recording and you can push it back. I think that would be really neat to be able to connect and be able to see that so more people can witness your amazing music and have some smiles brought to their face.
That's a wonderful idea. I would like to give you folks an example, if you want to, sometime during this, maybe later on, an example of how it sounds and what I look like and how I produce it. Some of my music on video conference, if that's okay with you, give you an idea of what goes on.
We would love to, for sure.
Okay.
I don't know if you want, we have a couple minutes. You could give us a little preview.
Well, we can have another
Great.
conference maybe next week. I'll have to get set up. I don't want to peel the paint off the wall right now.
All right. Well, we'll be able to get something together. I don't think we'll be able to do it next week because we've got to get some marketing out on it, and we want some people to attend. Unless you want it to be our small group. Our small group, we can make a time anytime, for sure.
Yeah, just for the small group to let you
Okay.
you and
We
Dr.
would love to.
Miss Hatten and the other folks know and show you what goes on. It won't take very long, just maybe about 10 minutes, 5-10 minutes.
All right, I'm sure we can make that happen. We'll coordinate a time with you afterwards. Anybody else that's hanging out in the chat box or anybody else that wants to pop on video to add in any questions, lingering input, things that they've experienced, anything like that? I'm just scroll.
I apologize. I just wanted to say this one thing, that I have never charged a VA or any veterans or anybody for my my performances, and I never will.
There was a way to find a way to compensate you a little bit, though. We'll have to just spread the word or do something that we can recognize you for what you're doing.
Yeah.
Well, it looks like I don't see anything else in the chat. We really appreciate everybody joining us. And Conrad, your time, Kate and Dr. Lum, we had some really great discussions. I'm really excited for how this all fell together and the participation we got. Did you have any wrapping or questions or comments to wrap up you wanted to touch on?
I put into the chat, thank you all for joining us. As Veteran Community Partnership, we are always interested in relevant topics that you would like to have as a panel discussion. So please email Courtney McGuire or Katie Stengner as our chairs. And thanks for participating today.
We really appreciate it. And the attendance was wonderful and got to see some smiling, familiar faces. So thank you so much. If there's anything that you need as a follow-up, please email us. And then again, this will be on the VCP website, which is up in the chat. And then the presentation that Dr. Lum put together will be there as well. And Kate, if you want yours to go up, just email it to Courtney. Awesome.
Thanks, everyone.
You guys have a wonderful day. Thank you.
Ms. Hatten, are you going to contact me, or how am I going to get a hold of you?
I put my contact information in the chat. If I think I have your email, I'll follow up with you.
Thanks, Ms. Hatten.
Thank you, everyone.
Thank you. Thank you, Conrad.